Okay.
All right, good morning, Deborah.
Good morning.
So thanks for agreeing to do this interview with us.
Yes.
To be clear, just to everybody, you've signed a form that says it's okay for us to do this.
Yes, I did.
And it's okay to share it with other doctors, nurses.
Oh, yes.
Anybody who needs to see it. I may record this and put it on YouTube on a channel where anybody can see it. Is that okay?
That's fine.
Great, okay. So what were you here for today? Why did you come to our access center today?
Because I was clogged and there was tissues that had to be cleaned out.
In your catheter in your
Yes,
chest,
in
right?
catheter.
And how long have you had that catheter?
3 years.
3 years. And tell me what happened before you had the catheter. Like when you went onto dialysis, how did you start your dialysis treatment?
First, I did the Catheter.
Peritoneal?
Yes.
Is
And I was not elegant with it. I skipped and I didn't do what I should have done.
Did you have enough support, like from the nurses and our team of people to help you out with that?
Oh, yes.
Did you have
That's
any-
why we turned over to the one in the chest.
But I mean, when you had to stop doing peritoneal dialysis, it sounds like you blamed yourself for not doing all
Oh,
the
yeah.
right things.
Well, it was my fault.
But were there ways we could have helped you do it better? Or
No, the youth taught me everything that I needed to know.
did you have any family helping you at the time, or were you on your own?
No, I was on my own. My daughter's 3 hours.
So you were living down in the southern part of the state, in your
Uh-huh.
own home, independently?
Uh-huh.
But it just didn't work out,
Right.
and so then what decision was made next?
I had that put in
Catheter.
on the chest.
And that was about 3 years ago.
Yes.
Okay. How long did you try to do peritoneal dialysis?
6 months.
6
And they
months.
said I wasn't pulling enough out.
So it wasn't working as well as it should have either. Okay.
Right.
So about 3 years ago, you had a catheter placed because you needed to change over to hemodialysis, right?
Right.
And then what happened after that?
Then I had this, but then they talked me into doing my arm, and that was a nightmare.
Well, so you needed to have an access done to your arm. It's a normal thing. We usually encourage people to get a proper, what we call arteriovenous access. Did they do a fistula or a graft?
Fistula?
All right, let's take a look at it.
Yeah.
So this was the first operation you had on your arm, right?
Yep.
And this is a graft. This is a piece of artificial vein that the surgeon put in there. That means,
Yeah.
I believe, he didn't find any veins that were good enough for a fistula, right?
Right.
So what happened? You went to the operating room. They did that graft, and then what happened next?
The next day, I was like crunched. My fingers could not move. Could not move. And so I told him, and he was like, "I'll give it time." I said, "Okay." Went for my 2 weeks checkup, and same thing, give it time. I said, "How much more time do I have?" You know? So I was like this.
Was it getting any better or worse at that time?
Oh, it was worse. I mean,
Was it painful?
yes, it was very painful. I couldn't drive, I couldn't cook, so my quality of life went down.
You were totally independent with those things before?
Oh, yes, most definitely.
Yeah. So what happened next with this? The surgeon saw you again and decided to do something with it?
Well, yes, I went to a nursing home up here in Wilmington, and they sent me to a hand surgeon, and he sent me to their therapy upstairs, and now look at it. I can move it.
So it's getting quite a bit better.
Much better, yes.
If you work backwards a little bit though, before you came up here, the surgeon did go ahead and block this off, is that right?
Yes,
He took you
they
back to
went
the operating room?
Yes, but that was like 3 days later.
3 days,
Yeah,
3 days after the graft was
yeah,
first done?
the first time,
Okay.
yeah.
And so this graft was never used for dialysis?
No,
So it was put in,
because this was so cold, and it just was terrible.
and then why did you move up here to a nursing home?
To be closer to my daughter, because I couldn't take care of myself because of the damage.
And then, so you've been up here in this part of the state for now
A year.
a year?
Mhm.
And tell me what your experience has been with your dialysis catheters, the catheter in your chest.
It's good. I like it that way, and plus I had a couple clogs, but you guys have cleared it up, and I'm really happy for you.
Have you had any serious complications of the catheter? Have you had any infections?
Oh, no.
Debbie King.
There you go. Have
Sorry.
You, no, it's fine. Have you had to be hospitalized for anything?
No, for this, no.
Any other serious hospitalizations?
No.
Now, you have had some heart problems.
Oh, yes, heart problems, stroke.
How old are you?
66.
So you're pretty young, but you've had serious heart problems.
Yes.
Have you had a heart attack?
3
Have they had to do any procedures like stents or surgeries?
stents, like 7 of them.
And they put in a pacemaker and a defibrillator
Yes.
because your heart was
Yeah,
having...
the heart was having problems with the, what is that called?
The ejection fraction?
Ejection.
Right.
Yeah, it was like low.
So you've got what we would call heart failure. They put the defibrillator in as a protection for that, right?
Mm-hmm.
And you've not had any complications with that?
Nope.
Hasn't fired off at all?
No.
That's good. So now you've been dialyzing with the catheter for a total of about how many years?
3.
3 years. And now it's time to get a new fistula, right?
No.
Right. Now why not?
Because I'm not going that way.
Right. And
I'm happy with this.
and tell me what you're thinking. Is it, well, have doctors and nurses told you should get another
Oh,
fistula? graft?
yes.
And why have they told you that?
They're just saying it would be better. You can't have this in there that long.
And so what alternative have they given you? What have they told you should do next if you were to listen to their advice?
Oh, put it in this hand,
Yeah.
arm, but I don't want both hands messed up.
So obviously you're concerned that you'd be at risk for the same complication
Oh,
in your right arm.
Yes,
And that would affect your quality of life
total,
totally, right?
yeah.
Now, if I tell you that there's medical science evidence that says that you would live longer if you had a graft or a fistula than you will if you have a catheter, what does that mean to you?
And I don't care. This is my last resort, and that's how it's gonna be.
And if you have further complications with this catheter, like say you did get a bad infection, it could be pretty serious, it could cause a lot of problems,
Right,
and you realize that.
yes,
And you know you could end up with complications of those types of infections.
yes,
Right.
but, there's medicine to clear it up.
And how is it that you've avoided that complication so far?
Keeping it clean and, letting you do my treatments.
Have the nurses and techs at dialysis taken good care of it?
Oh, yes.
They must be.
They do, they
Yeah.
clean it.
Good. So, what would you have to say to doctors and nurses who are looking at this situation in terms of you as an individual and how all this has affected your life?
I just hope they realize this is my choice and that's how it's gonna be. Because I'm not gonna have another defect done. And that could happen.
What if I tell you this? I'm not sure if you know this, but the people who pay the bills for dialysis patients and the payers, Medicare, and the insurance companies and certain other organizations want to penalize dialysis clinics or doctors, that is, pay them less for their services if they don't have a graft. So if we have a catheter in your chest, they want to pay us less for taking care of you because they don't think we're doing
Well,
a
I
good
don't
job. What
think
do you
that
make of
would
that?
be, I don't think that would be right because it's better for some people to have this than the arm draft. And,
Were you aware that might be the case?
no, I didn't.
See, I think a lot of people may not be aware of that, and
Right,
that's not what's primarily motivating all these people. They're trying to do the right thing for your health based upon what we believe to be good medical guidelines, but at the same time, there is a financial component to it. We'll get paid less for doing your dialysis.
that's not fair.
And we don't think that's fair either, but
No.
that's the way it is, and I think for you, that puts you in a bit of an awkward spot, and I'm glad you know that now, because when you hear this proposed,
Sure,
you realize that there's more to it than just wanting to follow a guideline. There's a deeper story to that.
Yes.
How about going back on peritoneal dialysis? Have you considered that?
Yeah. Well, I would like to, but I'm gonna go to assisted living, and there's nothing there to be able to help me with that.
Yeah.
So,
You think you would need help to be able to do it?
yeah, hooking it up every night. You know I have a friend in Florida that does it every night, and he says, it's hooking it up and getting it set up, and he likes it. But I told him I like it in my chest. I said I love it.
Would you be able to work the system with your hand as it is? Have you got enough function in the hand that you
No,
can make those things
it's so
happen?
numb now. I have little use of it, but it's numb, and I just couldn't do what I used to do.
Why do you said you love the catheter. What do you love about the catheter?
Well, it's easy to take care of because when I get a shower, I have the plastic to cover it, and the centers really work good to keep it clean.
You find it easy to go on and off dialysis in terms of the getting hooked up and unhooked?
Oh, that's, much better than the belly.
The belly. And how about have needles in your arm?
Oh, no, I'm not a needle person, and I see people around me, they're bleeding out and all that, I'm like, no, thank God, this didn't work.
Thank God this didn't work.
Yeah,
Okay, well, you're making some lemonade out of that lemon, aren't you?
yeah, this is much easier.
All right, well, Deborah, thank you for sharing your story. I guarantee you this will be powerful and useful to a lot of people, patients and nurses and doctors.
I hope it is.
And so, thank you very much for
And
doing
you
that.
did a wonderful job today.
Well, thank you. I didn't want to hurt you.
You didn't.
Yeah.
Yeah.
We actually did your catheter a little differently today. Can I just show?
Sure.
Without exposing you. Oh, a little drop of blood there. But we brought it out a little toward the middle because you didn't like it hanging down towards your armpit.
Yes.
So this is hanging down between
Yep.
the breasts, so it's not going to dangle into unpleasant areas. And hopefully that'll be easier for you in dialysis as well, because you can just open the front of your
Right.
gown, pop it right out.
Yep.
Good.
Yeah.
All right, well,
Well,
thanks.
thank you.
Happy New Year. I really appreciate you taking the
too.
time.
Thank you. All right.